Hello and welcome to Liberty Nation's LNTV. I'm your host, Mark Angelides. Now today, to discuss something very strange happening in Philadelphia, we're joined by Liberty Nation's Legal Affairs Editor, Mr. Scott DiCosenza. Welcome, Scott.
Hi, Mark.
Scott, straight from the hip here. Is Philadelphia somehow legalizing heroin? Is that what's
No. Much to my libertarian chagrin, Mark, they're not legalizing heroin. That would be great news because of all the crime and trouble that the prohibition of heroin causes rather than the drug itself. What's happening in Philadelphia is that there's this organization called Safe House that are trying to reduce the negative effects of heroin use and addiction in the city by providing what they call a safe access place where addicts will go and shoot heroin and use the drug without having to worry about primarily overdoses, but also other things that affect that population, physical safety, for instance, and other things.
So it's not so much the results, the negative impact, it's the negative outcomes that they're trying to diminish rather than the negative impact.
Well, overdose deaths in the wake of the fentanyl crisis are off the charts, Mark. And the presumption is that, well, not a presumption, the research indicates that many of those or most of those deaths are totally preventable if they're people who were using the drugs had access to health care at the time of their overdose. These are not people who have tried to kill themselves, like literally. They haven't tried to commit suicide with the drug. They've tried to take the drug and survive it and get high. But because of the illegality, Mark, when in the United States, if you buy a bottled liquor, it's going to say the ABV or alcohol beverage value content right on the label, how much alcohol is in this drink. Same thing with most wines and beers. The same is not true for heroin. The people who buy heroin don't know if they're buying the new dose that they just bought today could be 10 times more potent than the dose they took yesterday. They have no way of telling.
Okay, but this safe haven wouldn't really solve that particular issue, would it?
Well, what it does solve is if somebody takes more than they wished to and they nod out and are going to proceed to die because of the overdose, the staff of the safe house will intervene and resuscitate them and give them Narcan or whatever other health measures are required to revive them, rather than just the back of some alley where they're going to turn up dead.
This is sounding strangely familiar. Has this been done before?
This, Mark, has been done in Vancouver, Canada, I know, and other cities across Canada and Europe, but never in the United States. This would be the first.
Okay. And I mean, is there a state and federal issue here?
Well, the state, I don't think, has weighed in on this issue, but the federal government has tried to stop the implementation and opening of this clinic. The Trump administration went to federal court to basically accuse these healthcare advocates, and they are healthcare advocates, just to be clear. These are not, like, for instance, people who wish for heroin to be legal. These are public health people, the deans of the hospitals and teaching hospitals, and people who work with these sort of at-risk addict populations to try to get them back into society. Anyway, the Trump administration has sued and basically tried to use laws that federal anti-crack house laws, which were passed at the height of the drug war, to accuse these folks of basically essentially trying to run a crack house or sort of an opium den, I guess would be the more analogous charge. Sorry.
And is the Trump administration right, in your opinion?
Oh no, they're not right. I think that it's a political determination, Mark. To any decision to prosecute something like this is a political determination. So for whatever reason, right now in the United States, heroin and marijuana share one thing: they're both on the most restricted list in terms of their Schedule 1, which says there's no benefit at all to them medically. Now, we think about marijuana and how many people in the United States use marijuana for the alleviation of everything from minor aches and pains to major post-war PTSD, and you know how laughable that is. Well, I don't think that we're going to see heroin used like marijuana is, but to approach heroin from a public health crisis rather than a criminal justice model is a political decision. I don't know why the Trump administration has taken the criminal justice model. They seem to be able to buck trends and swim against the current in so many other areas of policy making. I do wish some bright eyes could take a look at this policy issue and say, we need to be more about saving the lives of our neighbors rather than trying to punish people who use heroin.
Well, thank you, Scott. That's an incredibly interesting take. Much appreciated. Thanks for joining us.
Thanks, Mark.
And thanks to you at home.
Hi, folks. Lisa K. Donner here, editor-in-chief of LibertyNation.com. We hope you enjoyed watching this video, maybe even learned a thing or two. If so, please take a moment and subscribe to our YouTube channel right down there in the corner. Thanks so much.